We are calling it Live, Learn, Love, our focus this month on beating breast cancer. Tonight we learn what is the very latest going on now in breast cancer research. What about that breast cancer vaccine? Our Juliet Dreyer stopped by Mayo Clinic to get a look at some of the brand new technology.
One of the biggest fears that people undergoing treatment for breast cancer have is that it's going to come back. But that's one of the things that the people here in this building behind me on the Mayo Clinic campus are trying to prevent.
That's got to mean something.
It's an exciting day inside the Mayo Clinic's Griffin Research Building.
So you got the blue cells, the normal cells, you got the red cells, the tumor cells, and then you got the green cells, and the green cells are the immune cells.
This new tool just arrived this morning, mapping out different cells in the cross-section of a tumor. Professor of Cancer Biology Aubrey Thompson says it will help researchers determine how each patient will react to a different type of treatment.
The fact that you just don't see groups of green cells that are away from red cells tells me that the immune cells are interacting with these tumor cells.
That's the focus of much of the research, the immune system.
I think the way to go forward with the breast cancer therapy is to use patients' immune system to fight against that cancer.
Dr. Saranya Chumsri is a medical oncologist specializing in breast cancer. She's among the team collaborating on several breast cancer vaccines currently in clinical trials. The vaccines will be given to people who have already been treated for breast cancer once to try to prevent it from coming back.
Once it's recur, it can spread to other organs, and once that happens, it's become incurable.
It's going to be huge.
Keith Knutson has been working on a vaccine for triple-negative breast cancer for the past decade.
About 40% of individuals diagnosed with triple-negative breast cancer will relapse over the course of 5 or 6 years.
The vaccine is currently in phase 2 clinical trials. 290 patients are enrolled in the trial. 2/3 will get the vaccine, the rest a placebo. Over the next few years, researchers will monitor whether the vaccine prevented the cancer from coming back.
When you know that you've been diagnosed with a potentially deadly illness and that you have a high risk of that disease coming back, there's no question that takes a toll.
While the focus for now is on preventing the disease from recurring, these are just the first steps toward preventing breast cancer from happening altogether.
That is basically the ultimate goal, to prevent it entirely, but we have to start somewhere.
Juliet Dreyer, First Coast News on your side.